Hi, my name is Anna Rose Lemba, and I'm going to be presenting on H.R. 4534, Women in Lung Cancer Research and Preventative Services Act of 2024. This is just my author's note. So what's the issue? Lung cancer is the second most common cause and leading cause of cancer death. Lung cancer can be caused by smoking cigarettes or being exposed to secondhand smoke or other environmental factors. Studies have shown that 10 to 20% of those diagnosed with lung cancer have never smoked. Of the 234,580 new cases of lung cancer expected in 2024, 118,270 of those will be women. This statistic shows that lung cancer is more prevalent in women. The current guidelines from the American Cancer Society recommends yearly screenings with a low-dose scan for people aged 50 to 80 who smoke or used to smoke and had a pack of cigarettes a day for a year. It recommends continuing annual screening until the patient quits smoking for more than 15 years. However, with current legislation under Title 27 of the Public Health Services Act, it shows that other types of cancer screenings are free, regardless of pre-existing conditions. Breast cancer begins at age 40, prostate cancer begins at 50, and colorectal cancer at age 50. Lung cancer screening can prevent deaths and create a higher likelihood of successful treatment. In addition to gender, research has also shown that there are socioeconomic inequalities in lung cancer as well. It found that those with a lower education level tend to work in places with higher exposure to environmental hazards like air pollution and higher physical risks. Also, those with a lower income were associated with lower screening eligibility due to a lack of health insurance and transportation to screening centers. So you might be asking yourself, why are women at a higher risk? Current research has not found why women are at higher risk, but there are hypotheses related to plausible biological differences like hormonal factors, molecular changes, and other genetic factors. There have been a higher incidence rate of lung cancer among non-Hispanic white and Hispanic women born since the mid-1960s. There's no consistent data showing the effect of estrogen or other reproductive hormones with lung cancer, and if women are at a higher risk from the carcinogens of tobacco. However, one research article looked at the data from sex-based differences in the biology of lung cancer. Their research showed that hormones can influence cancer risk and progression. Other research found that women with a later onset of menopause and the endogenous estrogen, there was a reduction in lung cancer risk. Also, women who had a radiation therapy for breast cancer were shown to have an increased risk of second primary lung cancer as well. With the study that looked at molecular changes, it looked at Asian women with and without lung cancer and non-smokers. The differences noted in the DNA markers was a great finding because it's never been seen before. More research needs to be continued on sex-based differences to confirm these hypotheses and how these factors may impact treatment and the screening of lung cancer. During my research, I found this great video which shows Katherine Benson's story. She was a 40-year-old non-smoker diagnosed with lung cancer. There was a bill introduced to the 116th Congress named after her, known as Katherine's Lung Cancer Early Detection and Survival Act of 2021. Unfortunately, this bill did not make it past the introductory stage. However, it sums up the importance of why we need better early detection methods, especially for women and non-smokers.
I had a persistent cough, and I went into the doctor's office reluctantly right before Christmas. So I got the call on New Year's Eve morning, and the pulmonologist said, "You have stage 4 adenocarcinoma, non-small cell lung cancer." I'm coming up on 5 years. So you can see me today and I look great, but anything can happen. Just lost 2 friends this week and they look just like me, and our bodies aren't compromised, and we're dying inside. I think about my kids and not being here. It's not a matter of if I'm going to die, it's a matter of when I'm going to die. And I know that that's going to happen. it makes me very, very frustrated and angry that we don't have the funding to find out why 433 people are dying every single day of lung cancer in the United States alone. And that's a jumbo jet going down every single day.
Wow, what a great video. So with HR 4534, it was introduced by the U.S. House of Representatives on July 11th, 2023. The purpose of this bill is to evaluate research on women and lung cancer, including access to preventative services for women, and to create public awareness. There are higher incidences of lung cancer in non-smoking women than men. Current research has not found why women are at a higher risk. With legislation like HR 4534, it allows additional research to be conducted to explore these biological differences in order to create better prevention and treatment methods for women and lung cancer. So this bill was introduced by Representative Brendan Boyle. He said that even though there has been progress in preventing and treating lung cancer in recent years, there is still a disparity among women. He hopes to empower the medical community to research the prevention and treatment of lung cancer in women, especially for non-smokers. The bill was originally co-sponsored by 5 people, which is listed to the right, and it now includes 35 people. One of the original co-sponsors was Representative Brian Fitzpatrick. He and Representative Boyle both chair the Congressional Lung Cancer Caucus. The Congressional Lung Cancer Caucus was created by former Congressman Rick Nolan under the GO2 Foundation. This helps members of Congress understand the issues surrounding lung cancer. The advocacy group GO2 for Lung Cancer is in favor of this bill. The president and CEO, Lori Fenton Ambrose, wrote along the press release from Congressman Boyle when he announced this bill. Lori explained that the research on understanding lung cancer in women has lacked, and it has resulted in poor health outcomes. By having a better understanding of factors like clinical characteristics, it can help advance preventative and therapeutic practices for women. The Women in Lung Cancer Research and Preventive Services Act was originally introduced to Senate in 2023 as S-2245 by Senator Marco Rubio. Then it was introduced by the House of Representatives. On June 12, 2024, the Committee on Energy and Commerce met and ordered HR 4534 as amended, with a vote of 45 yeas and 0 nays. This shows that it was favorable and there was no one voting against the bill. The bill is still in the introduced stage, but the most recent action was on July 30th, 2024, when it was placed on the Union calendar number 520, and it is now in the Committee on the Whole House of the State of the Union. Other than Representative Boyle's initial press release, there isn't much social media or press coverage on this subject. Representative Boyle is active on X, formerly Twitter, and Facebook as well, where he talks about other issues. I found this post from 2020, and I felt it was worth highlighting because Representative Boyle secured $20 million for lung cancer research in fiscal year 21 and declared November as Lung Cancer Awareness Month. Although these were great milestones, I think there needs to be more press coverage from Representative Boyle on this subject. Society tends to think smokers are to blame for their own disease, and 17% of people think that health systems should not cover lung cancer patients who smoked. It continues to show that there's inequalities and challenges within the continuum of lung cancer care, and with more publicity, it can help with further research and guidance. As a nurse and advocate of the American Cancer Society, I'm definitely in favor of increased access to lung cancer screenings. In the American Nurses Association Nursing Code of Ethics, Provision 3 shows that it is the nurse's role to support health promotion and disease prevention through things like access to preventative care and screenings for lung cancer. In Provision 7, it highlights that research with determining why there are high rates of lung cancer in non-smoking women can help ensure we use evidence-based practices for treating our patients. I liked the Bible quote from Proverbs 31:20 because it shows the importance of caring for others by using services and compassion, which I think is what nursing is all about. We as nurses can help support women and other vulnerable populations by recommending preventative services like lung cancer screenings. I agree with Representative Boyle that in order to fight to end cancer, we must do everything we can to give patients the resources they need. I like the idea of this act, but I do not think it should be passed in its current form because there's a few areas for revision. The idea of lung cancer prevention screening and this bill have been around for a few years, but the bill never makes it past the introductory stage. In the bill, Catherine's Lung Cancer Early Detection and Survival Act of 2021, it only has 2 co-sponsors. Now with this bill, the Women in Lung Cancer Research and Preventative Services Act of 2024, there's 35 co-sponsors. This shows increased support, but it needs to continue and show even greater numbers. In this bill, it states that it hopes to require a review of women and lung cancer and for other purposes. This wording is very vague, and I think it needs to be expanded. It states that the Department of Health and Human Services would review and identify research opportunities, but I think it would be beneficial to include stakeholders like advocacy groups to get their opinions as well and state the research itself. Under the new Budget Authority, Entitlement Authority, and Tax Expenditures section, it stated that there will be no new or increased budget for this bill. There needs to be adequate funding for this research in order to be successful. Without an increased budget, it limits the effectiveness because there's no room for adjustments. With these recommendations, I think the bill can be very successful. There is a need for a bill like this because lung cancer is becoming more prevalent in women and is the leading cause of cancer deaths. The question remains, why are non-smoking women more likely to be diagnosed with lung cancer? Lung cancer research is an important topic of discussion and can help decrease lung cancer mortality. I believe this bill is the type of legislation we need to continue cancer advocacy and create better public health outcomes related to lung cancer morbidity in women.